This is a crisis that our nation is facing right now. It's all of Canada. It's all North America. It's worldwide.
The death of a man who was repeatedly denied help with his substance use here in Winnipeg will now be closely examined through a provincial inquest, and his loved ones and advocates in the province say they hope the process starts to address gaps in the system that they say are costing people their lives. Lee Earnshaw, a commercial fisherman who was well loved by his family, died June 14, 2021, after he was found unresponsive in his tent in Winnipeg after consuming Gold Down, a mix of fentanyl and meth, resulting in an accidental and fatal overdose. And while he was desperately trying to get help with his substance use through provincially funded programs at Main Street Project and a rapid access to addictions medicine clinic, a news release from Manitoba's chief medical examiner says he was turned away each time due to, quote, various technicalities, end quote. His older sister, Carol Packer, hopes the inquest helps prevent further tragedy.
Our family, what's important out of this inquest is that it identifies any of the gaps in the services and that those gaps are addressed and future deaths can be prevented.
In the future, Packer says she plans to travel here to the city from Edmonton, saying she wants to see the crisis taking place in the province firsthand.
I want to trace exactly what not just Lee, but so many other people are facing.
Advocates in the province have been sounding the alarm over overdose numbers for years, with Manitoba overdose deaths recorded in 2021 set to surpass 2020. There were 314 drug-related deaths recorded up until August 2021, compared to 372 for the entirety of the previous year. That's according to data obtained by Overdose Awareness Manitoba.
The province has invested. It would be unfair to say that they haven't, but they're investing in sort of like this piecemeal approach.
Marion Willis is executive director of St. Boniface Street Links, which supports people struggling on Winnipeg streets. She says the inquest is welcome news, as right now people in the province sometimes can't get help.
You know, this has to stop. You can't tell an addict, not an alcoholic, not a drug addict, not any kind of an addict, to come back tomorrow or to come back next week. You have to be able to meet that need right now.
A longtime soldier in the fight against overdoses and poverty in Winnipeg, Willis says the current approach is not working and a community-based system is needed, as reliable access is literally life or death. Willis says the daily shortfalls in the system that result in people being turned away are pushing them back into the grips of addiction. Offering her condolences to Earnshaw's family, Mental Health and Community Wellness Minister Sarah Gimard says the province has already taken action to address the crisis, but notes there is more work to be done. The statement read in part, quote, "The Manitoba government understands the importance of addressing the rising number of overdose deaths in the province, and we are committed to doing so using a balanced approach across the 4 pillars of prevention, intervention, treatment, and recovery," end quote. The minister says the government will, quote, "welcome any answers that come out of the inquest to assist our government in improving support for those in need," end quote. Opposition NDP's mental health and addictions critic Bernadette Smith says the inquest is needed and Manitoba has to ensure there are wraparound services in place, saying the government must, quote, "do the right thing," end quote, when it comes to the inquest outcome and recommendations.
You always want to have hope, right, that this government's going to do the right thing, and the right things mean saving lives in Manitoba. There's so many people that have lost their lives waiting to get into treatment.
In Winnipeg, Modjeski, City News.
Next on City News.